Welcome to the IFRS YouTube channel. Today we're going to talk about bladder cancer for rural areas, how we diagnose and treat them. How common is the bladder cancer? It is a fairly common cancer because 6% of cancer of all men and 2% of all women's cancer are from the urinary bladder. And the transitional cell carcinoma is the most common variety. Although sometimes other types of cancer occur. The advantage is that it is an easily treatable cancer and has a fairly good prognosis. And this is one of the cancers which has definite risk factors associated with it. For example, people who work with the various chemicals like the paints, dyes, metal and petroleum products, rubber or leather industries, or textile workers, they're much more prone to bladder cancers. And sometimes even the food preservatives contain chemicals that can cause cancer. So these people, especially those working in leather industries and chemical industries, if they are smokers, the incidence or chance of them having bladder cancers is very high. And the other professions like mechanics, drivers, they are also at risk for getting this cancer. Another important risk factor is water, which is contaminated with arsenic or water which is treated with chlorine. In some of the areas in Northeast, especially bordering Bangladesh, they have a very high arsenic content in the water. And obviously, there are genetic factors which also contribute. So if there is a family history of bladder cancer, and if they smoke or are exposed to any of these chemicals, they are more likely to get these cancers. Earlier, a couple of decades ago, schistosomiasis was common and was a contributing factor when India had a lot of open wells. What are the symptoms? We need to consider bladder cancer as one of the options, especially if patients have irritative voiding symptoms. We've been discussing about it with bladder outflow obstruction and urinary tract infection. Again, the bladder cancers can also cause exactly the same irritative voiding symptoms. However, the most important symptom is hematuria or blood in the urine. This can be either microscopic or macroscopic, which can be seen with the naked eye. And sometimes they can also present with the urinary retention and lower abdominal pain and so on. But the most important presentation is hematuria, blood in the urine. What are the investigations which are necessary for a rural area? The most important investigations which can be used for, again, in the follow-up period, is the urine microscopy. It's a simple test to look for blood in the urine. And if there is blood in the urine, sometimes if facilities are available, you can centrifuge and use it for cytology. And in many of the rural areas also, ultrasound examination is available. As the picture shows here, these lesions can easily be seen in ultrasound. In some of the Western countries, they have sniffing dogs which can diagnose. And of course, CT scan is a good investigation, which will also tell us the prognosis. But the most important take-home message is that you need to do a cystoscopy or have a look inside the bladder. Any blood in the urine, whether microscopic or macroscopic, it is important to go in and have a look. This picture is the most common type of presentation, like a seaweed or frond-like appearance. Now, of course, there are other ways it can present. And the most important investigation is the cystoscopy. And then we need to stage. This is primarily to give the prognosis. And the treatment, again, differs quite dramatically depending on whether the cancer is involved the muscle layers or not. If it does not involve the muscle layer, as these lesions are, then the prognosis is very good. And the treatment is transurethral, or you can do with the endoscope, proper treatment. But once it invades the muscle or goes out of it, then everything becomes bad and you need open surgeries. Again, this defines a risk. If it is a small lesion confined to the bladder, then it is a low stage cancer, and the risk of it recurring or spreading is very low. While intermediate tumors are multiple, maybe large, but again, as long as they don't involve the muscles, can be treated quite comfortably through the normal urinary passage. Of course, when they go out of the muscle, then it becomes a high risk. And what are the treatment? Like the prostate, the transurethral resection has been the standard treatment or gold standard for treating these. And of course, it is a little difficult because you need to realize that bladder is a circular organ, and this is the movement of the scope. So then you need a little bit of experience to properly resect. So people who are not experienced with the transurethral resection can cause perforations and cause a little bit of damage. But then once you take biopsies, the procedure that we do, which is called transurethral vaporization, it's enough to just touch the tumor, it'll vaporize and make it disappear. And it is a good way of treating it. Of course, there are other treatments. If the multiple lesions or the entire bladder is covered with lesions, you can give immunotherapy, which uses BCG. But we have had to treat almost patients with 30 to 60 vials of BCG, and we can also put in some chemotherapeutic agents into the bladder or give chemotherapy. But then these are not advocated and not very useful. The most important treatment is to have a look inside, and if there is any lesions, to treat it, remove it, or burn it. Open surgeries, as I said earlier, is a highly risky option because it causes very significant morbidity. And again, you need to have a stoma through which the urine continuously keeps coming. So you need to walk around with the bag. And even in very good centers, there is a 1 out of 10 chance of death during the procedure or immediate postoperative period. But the good news is that once they survive the initial period, 70% of them disease-free. And what about follow-up? This is the most important thing, especially for bladder cancers, because these are multicentric. They keep occurring in many places. And only when they grow large, we can see to the naked eye, even through the endoscope. So it is important to have regular follow-up. We need to have monthly cystoscopies to check if there is any recurrence. And these recurrences, when they are small, it's very easy to burn them or remove them. And once there are 3 times there is no recurrence, then what we can do is have scopies once in 3 months. Then again, 3 times there is no recurrence, we can shift to yearly scopies. But then the regular follow-up is important for many years. We had some patients in our experience who've been followed up for almost 12 years. And the moment a small lesion appears, we can keep vaporizing them. And in between, if they develop any symptoms of blood in the urine, they should be told to report immediately. And this treatment or check cystoscopies or follow-up can be done in any remote areas. All you need is the cystoscope, which now we have devised a very low-cost cystoscope and a small instrument called Bugby electrode, which is shown here. Once you use this, it is very easy to treat it even in rural areas. Thank you.